Hello, this is Dr. Kant Shah here, Pediatric Robotic and Laparoscopic Surgeon. Today we are going to talk about laparoscopic surgery for children. So the first question that comes to mind of most people is, what is laparoscopic surgery? Laparoscopic surgery is also known as keyhole or telescopic surgery. It basically is minimal access, which means that we don't have to make a big cut to reach any organ of the body. We make small holes, and through these holes a telescope or a camera can go in and some instruments can go in, and by video assistance looking at a screen we can operate on the child. This technology has evolved so much that now the incisions are going smaller and smaller. For laparoscopic surgery, the telescopes have gone down to 5 or 3 millimeter and the instruments have gone down to 3 millimeters in children. And the video imaging is so advanced that we can see everything in 3D and 4K resolution. And we even have technology today where we use image guided surgery. So we can highlight certain parts of an organ to see what is diseased and what is not diseased and know exactly where to cut. So in our hospital, we use a combination of all three: video assistance with 3D, 4K and image guided surgery. So what is the main difference between traditional surgery and open surgery? I had the fortune of witnessing a lot of open surgery in my early training days, but soon enough, as soon as I went to England, I realized that laparoscopic surgery is here to stay. And over there, a lot of complex operations were being done, which then, once I got back, we have slowly incorporated into our practice as well. There are many important differences. It starts from the incision. The incisions are much bigger in open surgery, usually a few centimeters long, even in a small baby. The longer the incision, the less the tensile strength of the wound. It's not just a cosmetic problem, but even the wound healing. The muscles which are cut, when they heal back, the ability and the strength of these muscles is never 100% after surgery, and this risk is far higher compared to laparoscopic surgery, which is a few millimeters. From the video assisting camera, we can actually reach to every corner of whatever body part we are operating in. So whether it is the chest or the abdomen, we can actually reach every corner, and hence through minor incisions we can actually reach a much bigger area. So if you do an open surgery in the right part of the tummy or the abdomen, you can only reach most of the right part unless you make a big enough incision to reach the left part. Whereas for laparoscopic surgery, we can just change where we are standing and we can actually see the other areas of the abdomen completely. So the access is much better in laparoscopic surgery. This is very important when we're doing complicated appendicitis surgeries or a kidney or a bladder or a complex combined esophageal with abdominal surgery, etc. The other biggest advantage is that in laparoscopic surgery, the vision is very magnified. As I said, it is also 3D and 4K and image guided. So we can work in a very small area, disturb very small parts of the tissues. So I don't have to push anything aside to reach where I have to reach, or I have to push very little aside. So all the tissue reaction to the surrounding structures is minimal, which reduces the scarring, which reduces the complications, which makes the recovery much faster. This also leads to much lesser blood loss. And all of this eventually culminates in shorter hospital stays, faster recovery times, and eventually lesser complications. So what are the common surgeries that we do in children with laparoscopy? Well, today our intent is to do almost every surgery by laparoscopy. So even in a newborn baby, if they have a hernia, which could be a small inguinal hernia or even a big thoracic diaphragmatic hernia, or they have an esophageal problem, or they have a kidney problem, all of these surgeries right from a newborn age, we do it by laparoscopy. There are very few surgeries which we say, such as very large tumors where there is a lot of risk to life, where we need to be very fast. These are the only places where we would suggest not to do laparoscopy. Commonly, hernia surgery, appendicitis surgery, undescended testis surgery are almost exclusively done by laparoscopy today. And for us at our hospital, even the most largest kidney surgeries, bladder surgeries are exclusively done by laparoscopic surgery. So if I tell you about my experience, I started seeing advanced laparoscopic surgery in England in 2005, and since then I've been trained to do these surgeries, and by 2015-16 when we started doing them on our own, the experience has been remarkable. Initially we used to do them only on cases or surgeries which were easier to do in bigger children, But now, because of the technology which has really helped us, we are able to do it in even newborn babies. So if you look at the parent's side, any parent who has a child who has laparoscopic surgery, they may not understand the full experience of that right in the beginning. But if you see those parents after a month or 2 months, you will realize that they don't have to grapple with a post-surgical child, as in the child is almost as if they have not had surgery. Even with the most complex surgeries, by 2 or 3 months, the child behaves, the child walks, the child plays, the child does all their routine normal work and play as if they've never had surgery. And this is the advancement that laparoscopic surgery can really bring. And in my experience, this is the biggest gratification that I can have as a surgeon, and parents can have a stress-free life within a couple of months after even major surgery. Of course, there are safety concerns also, and it is not a one-person effort. We work with our anesthetists very closely. Our anesthetists are pediatric anesthetists. They do not give anesthesia to adults. And hence, when they adapted to laparoscopic and robotic surgery with us, what happened was they had to change a lot of things also. How they give anesthesia, right from giving anesthesia to a big cut and to cover small holes is different. Whether they should give more anesthesia because the pain is going to be more, or give less anesthesia because the pain is going to be less. So all these considerations were something which evolved along with us in the last 20 years. And today the surgery has become so smooth that most children can go home the same day after laparoscopic surgery, which is not very major. So in summary, any child can undergo laparoscopic surgery today. It gives much less scarring and hence faster recovery and less pain. And today it has a lesser risk of complications than traditional open surgery, and it is the way to go forward for any surgery in a child today. Thank you for watching this video. Please do like and subscribe and give us comments as to what more you would want to know about laparoscopic surgery from me, and I'll try and make videos on that as well. Thank you.